So who are you and what is Cali Vision and what is your mission?
So I'm Dr. Ashley Brissette. Dr. B, as most of my patients know me. I'm an ophthalmologist. So really my whole goal and my whole philosophy is just helping people see better. That's truly what I do day to day. I always say this is the best job in the world, the best job, like helping somebody go from glasses and contact lenses, not being able to see. And even for some people that becomes a safety issue. You know, you think about if something happened in the middle of the night and you couldn't find your glasses at the bedside, how would you be able to see to get out of your house? And so really being able to take people from that to being able to wake up and see without any need for glasses or contact lenses is pretty incredible.
Today, we're going to specifically talk about the EVO ICL. Let's do a bit of a one-on-one. What is it and who is it for?
Well, I have to say this is one of my favorite surgeries to perform as a surgeon for a few reasons. One, the surgery itself is such an intricate surgery. It is life-changing for people. Patients are so happy and thrilled with their vision after. And it's a very innovative way of thinking about fixing vision. So like in the past, all that we had to offer patients was laser correction. So that's a laser that would reshape the surface of your eye to fix your vision. And what we can do now with the EVO ICL is it's a completely customized lens implant. And it's customized for your eye shape, your prescription, your astigmatism. And it goes on the inside of the eye. So nobody sees it. Like they don't look at your eyes knowing that it's there. You don't feel that it's there, but it fixes your vision. And it can stay with you long lasting. It's made of a material called Collamer and it's completely biocompatible. So it's safe to be in your eye long term.
Yeah. What would give patients reasons to explore this?
Yeah, so often patients are looking for freedom or flexibility from glasses and contact lenses. Patients might have been told that they weren't great candidates for laser vision correction. They might have dry eye or other conditions that make them not a great candidate for laser or even a strong prescription. It's really interesting. This is actually one of the most popular ways to fix vision around the world, especially in Asia and Latin America where they have stronger prescriptions. And it's becoming more and more popular here in the US now because the results have been so good around the world. So if anyone was told they weren't a great candidate or they have a really strong prescription or strong astigmatism, they can be a candidate for this surgery.
Yeah. Okay, great. And how do you determine whether you are a candidate?
Yeah, that's a great question. So first things first, you always have to come in for a consultation to determine your candidacy. And like our philosophy at Cali Vision and my personal philosophy too is customized vision correction. So it's not a one size fits all approach, right? So you come in, we talk about your job, your hobbies, your lifestyle. We do an assessment of your eye shape. We also look at your prescription and then we discuss and we come up with a customized treatment plan for you. And so specifically for someone for EVO, what we're looking at is the shape of their eye and the strength of their prescription to see if they're a great candidate.
Great. I've heard some interesting satisfaction reports. Could you please explain that in more detail?
Yeah, I love talking about this actually because this has some of the highest satisfaction of almost any elective surgery. So 99.4% of patients that have had EVO ICL are happy with their surgery. And I also see this in my own practice too, because I'll do someone and then I'll do their brother and then I do his girlfriend and then their friend. So it's pretty incredible to see how it spreads like that as well by word of mouth and the referral and the just like, you know, the friend to family member referral pipeline is just really incredible because I think when you can see firsthand what somebody goes through, you really understand the ease of the procedure, the ease of the recovery and how happy patients are. And so I think that's why it can feel scary. And I hear this all the time from my patients, right? They feel nervous to have a surgery on their eyes. And so one of the things that I get asked the most is like, well, what if something happened? Like I'm feeling scared, I'm feeling nervous. And it's very, very common to feel that way. And so I think sometimes when you know someone who's gone through this and had great results, it really just helps to put you at ease as well.
Great. So, well, let's talk about recovery. What are the general recovery timelines and what would someone experience?
Yeah, so for recovery, I always say to my patients, it's fairly straightforward. You want to take about 1 to 2 days off of work.
Doesn't seem like much.
Yeah, exactly.
Yeah.
It's funny. I have a friend who's a plastic surgeon and he says for people that have a nose job, he tells them it's like a year before they get their like actual nose because of the swelling and this and that. Oh, wow. And I always think what we get to do in ophthalmology is like truly life-changing. Like I don't throw that phrase around that much, but usually the next day people are already starting to see better and feel better. And most of my patients go back to work a day or two later.
If I was thinking about doing this procedure and I wanted to see whether I was a candidate, what would happen at the consult specifically?
Yeah, so the consultation, when you come in to see us, the first thing that we do is just an assessment of your hobbies, your job, things that you like to do. I always ask patients as well, is there a reason why it's motivated you to finally come in? Because oftentimes people will say they've been thinking about doing something for years. And then sometimes it's like they got engaged and they're getting married. They'd love to be on their honeymoon glasses free. For other people, they're starting a new job, or maybe it's like a friend or family member had it done and they've like saw how happy they were. So it's usually something that I think finally motivates people to come in. Then we do a formal assessment of the shape of your eye. So we do very advanced imaging to really determine candidacy. Because I always say, like, the question for me is, are you a good candidate? I don't just do the surgery on everybody that wants to have it done, right? So I want to make sure that you're seeing well and feeling well for many years going forward. And that's my goal as a surgeon. So that screening and candidacy is really important.
After someone's recovered, what is their life like generally from before and after?
I think the one thing that I hear the most from my patients from after surgery experience is just how easy things are day to day. Think about travel, like not having to travel with your contact lens solution, your contacts, a pair of glasses in case something happens. And so the ease of day to day life and that whole, like, I can wake up and I can just see, I think is something that stands out a lot.
Why is flexibility and reversibility in this solution valuable?
Well, this is something that is so unique to EVO ICL that no other vision correction surgeries that are available have. So this reversibility factor means that I'm going to put this custom lens implant on the inside of the eye. But say if in 10 years, if in 20 years, a new technology came out and you would want that instead, or say if you ever wanted to go back to glasses or contact lenses, or if you just weren't happy and wanted to go back to what your life was before, you have the option where I can remove that lens and I have not actually changed the shape of your eye in any way. So it's completely reversible if that's something that somebody's wishing for. And I think that as well, the pace of technology is changing so much, so it leaves it open for your future too. Maybe it's a generational thing. I don't know. Like, we're a little bit afraid of commitment. Yeah. But if you are a little afraid of commitment, rather than a permanent laser that reshapes your eye, you can do the EVO ICL. It's a lens implant that can then be removed at any time.
It's quite an expensive procedure, but I wanted to break down the financial savings long-term versus traditional glasses and contacts. So contact lens might be disposable. You're spending $350 a year. Contact lens solution, $120 a year. Prescription glasses every 2 years, $200 a year. Eye exams, couple hundred, so nearly $1,000 a year. So have you explored that with your patients and the overall cost to benefit long term?
Oh, completely. And it's not just that. I also think a lot about the safety of wearing contact lenses too. There was a great research study that came out that actually showed that the risk of developing an infection from wearing contact lenses is like 80 times that of having eye surgery to get out of your contact lenses. So it's not just a cost issue, but it also starts to become a safety issue. And I have a lot of patients who can no longer tolerate contact lenses. They can lead to dry eye, to meibomian gland dysfunction and blepharitis. They can lead to infections on the surface of the eye. And so there's so many reasons as well why contact lenses might not be the best option for you outside of just financial considerations. So I think that's one thing. I think what's really nice to know as well is that we have financing available. There's a referral plan through the EVO ICL company as well. And so we have ways of making this available to many people.
What would the payback period be if somebody was to currently have glasses and contacts versus doing the EVO ICL surgery?
Yeah, well, if you kind of estimate on average, people are spending between $1,000 to $2,000 a year on glasses, contact lenses, prescription sunglasses, et cetera. Then honestly, it's on average about like just over 5 years that it would pay off. And again, these lenses can be in your eye long term. And if you get this done when you're in your 20s and 30s, you have many years ahead of you to see well with these lens implants.
Yeah, great. So it makes its money back.
It does. And I say to patients too, like, even if you're looking at the finances, it's well worth the investment because this is completely customized for you, right? Like, the face of medicine has changed so much over the past few years. It's no longer a one size fits all approach. So when you come in for your assessment, we're doing a custom lens implant based on your eye shape, your prescription, your astigmatism, everything. So it's completely customized for you.
Yeah, great. What are some success stories from past patients that you've seen?
I've actually done this surgery on a lot of doctors. A lot of doctors end up choosing EVO ICL for their own eyes. And I have a lot of colleagues that have done this in their children as well. So I think something that stands out to me is that doctors are choosing this eye surgery for themselves.
Okay, so this sounds great. What does the surgery experience actually end up being?
Yeah, I feel like people are always nervous when it comes to their eyes. Very common. I hear this a lot. So let me walk you through what would happen. So you'd come in for your surgery. First thing that we would do is give you a little bit of sedation. And it's just something that you could take by mouth. It just helps to relax you. I don't want you fully asleep for the surgery because sometimes I do talk to you and I'll say, look at the light or look here. And it's important that you're somewhat cooperative, although relaxed enough. So it's kind of like you've had a few glasses of wine or so. The whole surgery takes about 30 minutes. So it's pretty straightforward. I make a small incision into the cornea, which is the clear cover layer on the eye. It's only 3 millimeters, so it's extremely small. There's no stitches that have to go into the eye afterwards. And I slide the lens implant in. And I do the exact same thing for your other eye. So the whole thing's over in about 30 minutes. I'll say when it's done, most people sit up saying, wow, I can already see. It's pretty incredible. That's my favorite part too, sitting them up. And then they say that wasn't as bad as I thought it was going to be. Yeah. So we hear that a lot. Yeah.
That's great. I love that. And then you're walking out the door and you're going home.
Yeah. So most people will have like a friend come with them just to help out, or they'll take like an Uber, like taxi home or something. I always say just if we're in New York City, don't take the subway home, but I'm okay you getting home any other way. You'll go home that day and just want to rest. The next morning you'll wake up seeing better and feeling better.
That's amazing.
Yeah.
My roommate got something similar done and he comes home with these big glasses on. And he's got this app on his phone that's just explaining all the things in front of him. He was just walking around the house. It was so funny. Yeah. I don't know, it's like, that is a chair.
Yeah, some people are like hyper independent. They're like, I'll be fine. Okay.
So good. So good. Yeah.